Human metapneumovirus, or HMPV, is a respiratory virus. This virus primarily affects the respiratory system, causing a variety of symptoms that can range from mild to severe. It is part of the Paramyxoviridae family, which also includes other well-known respiratory viruses. It's been around for a while, but has only recently been identified. Despite its long presence, it wasn't until the early 2000s that scientists were able to pinpoint and classify HMPV. This discovery has opened up new avenues for research and understanding of respiratory illnesses. HMPV is a common cause of respiratory illness, especially in young children and older adults. These groups are particularly vulnerable due to their developing or weakened immune systems. In children, it can lead to bronchiolitis and pneumonia, while in older adults, it can exacerbate existing health conditions. It can cause a range of symptoms, from mild cold-like symptoms to severe pneumonia. Common symptoms include coughing, fever, nasal congestion, and shortness of breath. In severe cases, it can lead to hospitalization, especially for those with underlying health issues. HMPV is a relatively new discovery, first identified in 2001. The identification of this virus was a significant milestone in virology, as it helped explain many previously undiagnosed respiratory illnesses. Scientists are still learning about this virus and how it spreads. Research is ongoing to understand its transmission dynamics, seasonal patterns, and potential for causing outbreaks. This knowledge is crucial for developing effective prevention and treatment strategies. However, we do know that it is a significant cause of respiratory illness worldwide. HMPV has been detected in various countries, affecting people of all ages. Its global presence underscores the importance of continued research and public health efforts to mitigate its impact. HMPV symptoms are often similar to those of the common cold. These can include a runny nose, cough, and fever. Some people also experience wheezing, difficulty breathing, and ear infections. In most cases, symptoms are mild and resolve within a week or two. However, HMPV can be more serious in some people. Infants, young children, older adults, and people with weakened immune systems are at increased risk of developing severe complications. These complications can include pneumonia, bronchiolitis, and respiratory failure. HMPV spreads through respiratory droplets. These droplets are released when an infected person coughs or sneezes. You can become infected by inhaling these droplets or by touching a surface contaminated with the virus and then touching your eyes, nose, or mouth. HMPV is highly contagious, and outbreaks are common in the winter and spring months. The virus can spread rapidly in crowded settings such as schools and daycare centers. HMPV, or human metapneumovirus, is a significant public health concern in the United States. This virus, which is similar to the respiratory syncytial virus, RSV, primarily affects the respiratory system and can lead to severe respiratory illnesses, especially in vulnerable populations. Each year, HMPV is responsible for an estimated 100,000 hospitalizations. These hospitalizations put a considerable strain on healthcare resources, as medical teams work tirelessly to provide care and manage the influx of patients. The virus is particularly dangerous for the elderly and those with underlying health conditions, leading to thousands of deaths annually. These individuals often have weakened immune systems, making it harder for them to fight off the infection. These numbers highlight the substantial impact of HMPV on the American healthcare system. Hospitals and clinics must allocate significant resources to manage and treat patients affected by this virus, which can lead to overcrowded facilities and stretched medical staff. The lives of American citizens are deeply affected by HMPV. Families may face the emotional and financial burden of caring for sick loved ones, and communities must come together to support those in need. The Centers for Disease Control and Prevention, CDC, estimates that nearly everyone has been infected with HMPV by the age of 5. This widespread exposure means that the virus is a common part of early childhood, often leading to mild respiratory symptoms. Most people recover without any complications. For the majority, HMPV causes symptoms similar to a common cold, such as a runny nose, cough, and fever. These symptoms typically resolve on their own with rest and supportive care. However, HMPV can cause serious illness in vulnerable populations. For those with compromised immune systems, chronic illnesses, or advanced age, the virus can lead to severe respiratory distress, pneumonia, and even death. It is crucial for healthcare providers to identify and manage these high-risk cases promptly to prevent complications and improve outcomes. Section 5. The vulnerable. Who's at highest risk? In this section, we will delve into the groups of people who are at the highest risk of severe infections from the human metapneumovirus, or HMPV. Understanding who is most vulnerable can help us take the necessary precautions to protect them. Certain groups are more susceptible to severe HMPV infections. These groups include individuals whose immune systems are either not fully developed or are compromised in some way. This makes them less capable of fighting off the virus effectively. These include infants and young children whose immune systems are still developing. Because their bodies are not yet fully equipped to combat infections, they are particularly vulnerable to severe symptoms and complications from HMPV. Older adults, whose immune systems naturally weaken with age, are also at high risk. As we age, our immune response diminishes, making it harder to fend off infections like HMPV. This can lead to more severe illness and a higher likelihood of complications. Individuals with chronic respiratory conditions, such as asthma or COPD, are another group at heightened risk. These conditions already compromise the respiratory system, and an additional infection can exacerbate their symptoms, leading to severe respiratory distress. People with weakened immune systems, such as those undergoing chemotherapy or living with HIV, are particularly susceptible. Their immune systems are already compromised, making it difficult for their bodies to fight off infections, including HMPV. These individuals are more likely to experience complications from HMPV, leading to hospitalization and even death. The severity of the infection in these groups underscores the importance of early detection and prompt medical intervention. Recognizing the heightened risk in these populations is crucial for implementing targeted prevention and treatment strategies. By identifying those most at risk, healthcare providers can prioritize resources and develop specific plans to protect these vulnerable groups. This includes vaccination, early diagnosis, and tailored treatment plans to mitigate the impact of the virus. Public awareness and education are also key components in ensuring that these high-risk groups receive the care and attention they need to stay safe and healthy. Section 6. HMPV's potential for havoc. While HMPV is a relatively new discovery, it has quickly become a significant public health threat. The virus's ability to spread rapidly, coupled with its potential to cause severe illness in vulnerable populations, makes it a serious concern for healthcare professionals and policymakers alike. The lack of a vaccine or specific antiviral treatment for HMPV further complicates the situation. This underscores the urgent need for increased research and development efforts to combat this emerging infectious disease. Section 7. Shielding ourselves. Strategies for prevention. Currently, no vaccine exists for HMPV. However, we can take steps to protect ourselves and others from infection. Wash your hands frequently with soap and water. Avoid close contact with people who are sick. Clean and disinfect surfaces that are frequently touched. These simple measures can significantly reduce the spread of HMPV and other respiratory viruses. Section 8. The future of the fight against HMPV. Scientists are working diligently to develop a vaccine for HMPV. Several promising vaccine candidates are currently in clinical trials. However, it may be several years before a vaccine is widely available. In the meantime, public health officials are focusing on raising awareness of HMPV and promoting preventive measures. Early detection and prompt treatment of HMPV infections are crucial for improving outcomes, especially for those in high-risk groups. Section 9. A call to arms. Knowledge is our best defense. HMPV is a serious respiratory virus that can cause significant illness and even death. By understanding how the virus spreads, recognizing its symptoms, and taking steps to protect ourselves and others, we can help to reduce the impact of this emerging public health threat. Let's work together to raise awareness about HMPV and promote preventive measures to protect our communities.